Joining us live from Sir Gangaram Hospital is a third-year resident doctor, Dr. Edmond Fernandes, founder and CEO of CHD Group, joining us live as well, and Dr. Manish, President, Federation of Residents Doctors Association. Dr. Fernandes,
Yes.
Dr. Fernandes, what's the way forward then? You know, you have the President Association making it clear that, well, we are not asking for a review of the reservation policy. How do you make a distinction between the two? Because clearly, the case is about what constitutes EWS, what constitutes, or that's the direction in which it has moved, economically weaker section.
So, BHUPEN, I would like to propose that if we want to cultivate talent in the country, we need to be done with reservation. And as an alternative to support economically weaker sections of society to become doctors, researchers, and the medical talent of tomorrow's India, let us try to bring in an alternative policy such as saying that, okay, we'll give you the admission year, but you have to commit to working 10 years in aspirational districts in Tier 2 and Tier 3 cities of the country. I understand that EWS quotas would be a vote bank issue. It would become a political issue. It's necessary to thrive in the same ecosystem. But let us not mix talent with under-resourced medical fraternities and try to come out with a policy that does not benefit the country and worse still does not benefit a health system that is struggling to survive on its own.
What is the government's position here? Because, you know, I'm looking at both sides. Government wants us to believe that they don't have a problem with NEET PG counselling, but do they believe that the demand which is being made by the doctors, is it really leading up to revisiting the entire reservation debate?
Yeah, absolutely. I mean, the demand made by doctors is where the reservation is eating into the general merit. And instead of taking out the reservation from the general merit category, it would make more sense to rather increase the seats for PGs in general. My proposition to the government is simply equalize the UG-PG seat ratios, which will put would-be doctors and doctors in training and also resident doctors in a comfortable position and also supplement over a period of next 3 to 5 years the burden of shortage of doctors in the country.
Okay. Dr. Fernandes, tomorrow is the judgment day. Post that judgment, Dr. Fernandes, what do you think is the best way to resolve this crisis?
So, BHUPEN, here we are seeing two different situations. One is the government of India trying to float a new policy which factors in reservations for economically weaker sections. On the other hand, we have the Doctors Association simply saying that we want to enter the system. So the Doctors Association would distance itself from the fact that government policies need to come in place. It's not their prerogative, it's not their business. They simply want to enter the system as healthcare providers. What's happening on the other hand is the Ministry of Health and Family Welfare is trying to bring some reforms which in its true sense and wisdom is right according to them, but it is overlapping with the counselling at a time when the country is facing a severe Omicron wave. Now, what we need to think through is how do we revisit this policy which benefits stakeholders across the nation, which benefits hospitals over a period of time, and which also benefits those who are underrepresented in the healthcare profession. The goal by the policy is that we are trying to create an ambience, we are trying to create a system where OBC and other weaker sections come into the healthcare fraternity, become doctors, change their lives for good.
All right.
But are we doing it the right way? Is income a bracket to justify intellectual growth and talent? I'm not sure. There are many other parameters which we could look into, and that's where the social determinant of health as a policy framework needs to come in as a maturity which the health ministry can adopt, and it's freely available in public domain.
All right. Dr. Fernandes, Dr. Verma and Dr. Manish, I'm hoping that post tomorrow, when the Supreme Court comes with its verdict, I hope this rather unwarranted controversy is put to rest once and for all. We need doctors, folks. We need our medical system alive and kicking. We're in the middle of a third wave. We can't be confronted with this kind of an ugly controversy.
Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.